Still setting up, ladies.
Mm-hmm.
Here we go. Good evening, everyone. Welcome to Talk the Wellness Tea with Dr. Chalice. I am so excited tonight. We have a phenomenal panel of women, and we are going to be discussing chronic health conditions, mental health, and a multifaceted model of depression in African American women. So, I'm Dr. Chalice. I'm a licensed professional counselor, board certified telemental health counselor, cancer oncology behavioral health specialist. I'm a breast cancer survivor. And the whole month of October, I have been doing a Pink October series on breast cancer and mental health and various topics. So here we are, the last Monday of Breast Cancer Awareness Month, and we are expanding the discussion beyond just breast cancer to chronic health conditions, right? So whatever chronic health conditions we're dealing with in our mental health. So we're going to start with just taking a look at the multifaceted model of depression in African American women. I want to give you guys a brief overview, and then I am going to introduce our phenomenal speakers. All right, guys. So I am going to share my presentation with you all. So let's see. Here we go. Share screen. And let me share with you guys. Okay. So let's take a look. All right. So you guys should be able to see that. Can you all see the description of depression, of clinical depression?
Mm-hmm. Yeah.
Take a look at this description of clinical depression, because listen, we all have times where we feel sad, where we just don't feel well, right? But that doesn't mean that we necessarily have clinical depression, right? So here we're talking about clinical depression. And according to the DSM-5, within the same 2-week period, at least one of the symptoms should be either present: a depressed mood or loss of interest or pleasure. Okay. And then, the person must be experiencing 5 or more of these symptoms listed during the 2-week period as one of the qualifications for being diagnosed with clinical depression. So a depressed mood most of the day, nearly every day. A markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day. Significant weight loss when you're not trying to diet, or even significant weight gain. A decrease or an increase in appetite nearly every day. You can also experience this feeling of just slowing down, of your thoughts and even of your physical movements. And you may notice it, but you may not notice it, and others may notice it, that you're kind of moving slow. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt nearly every day. Diminished ability to think or concentrate, feeling indecisive nearly every day, like you just can't make a decision. For some, the depression actually escalates to recurrent thoughts of death or suicide. So just, it could be a passive suicidal ideation, just not feeling well and just feeling like, I wonder what it would be like if I didn't wake up tomorrow. That's more passive. But then a more active suicidal ideation is actually thinking of how you might do it and what you might use to commit suicide, actually committing suicide. So there is a difference there. Now, one thing with clinical depression, you have to have clinically significant distress in multiple areas of your life, because listen, life stressors contribute to our mental health. And, we need to be talking about that. When we talk about stress plays a huge role in chronic health conditions, in all chronic health conditions. And when we think of where our stress comes from, our stress, the majority of it comes from our relationships, which is why it's very important to manage your relationships, to create and maintain healthy boundaries and balance. And then there's different features of depression. Some people present with an anxious distress. So anxiety and depression are co-occurring, much of the time, not all of the time, but much of the time. So sometimes people can present with depression and anxiety, or it may just be a major presentation of depression and then symptoms may pop up here or there. So when we're talking about, so here are just some statistics on depression. And about 10.5%. So for Black women, we have non-Hispanic Black women. 11% of the population struggles with clinical depression when we take a look at this slide. Now, if we go to the next slide, let's just take a quick overview. And I don't want to spend too much time on this because I'm sure we'll all be talking about this. But, there are lack of diagnostic and treatment studies related to African-American women and depression. Not to say that there's no research out there, but we need more research. African-American women also experience racism, sexism, and poverty at higher levels than other groups. Depressed African-American women may perceive themselves as being devalued by society, and they may have fewer social supports, fewer support systems. And, our support systems are important because they help to buffer the stress that we experience in our life. Also, depressive symptoms may develop into clinical depression. So remember, I was saying not everything is clinical depression because we all have times where we feel sad, but sometimes these things, these life events, our traumas, our experiences can actually develop into clinical depression. There's also this assumption that all women, all African-American women share similar experiences. No. While we all may come from the same race, we have very different experiences, and we need to account for those experiences when we're diagnosing women, in how we measure depression, and even in our treatment strategies. Also, African-American women are at risk compared to their white counterparts for experiencing stress and negative outcomes in areas such as health, education, and psychological well-being. We also find that African-American women drop out of services at a significantly higher rate than white women and use fewer treatment sessions for mental health services. Also, African-American women have higher prevalence rates of depression, anxiety, and phobia than African-American men. And African-American women experience multiple problems in their lives because they contend with the intersectionality of gender, race, and class. African-American women also encounter discrimination both within their communities and outside of their communities. And we may also experience racism from other women as well as men. Also, the influence of both gender and race broadly impacts the personal development of Black women. Black women tend to suffer poorer mental and physical health outcomes than other ethnic groups, regardless of their socioeconomic status. African Americans drop out of services, and I think I said this earlier, at a significantly higher rate than other races. Let's see. So I think this is, okay, let's just go here real quick. African Americans account for approximately 25% of the mental health needs in this country, though we only make up 11 to 12% of the national population. And what's also important to note, because African American women, the overwhelming majority would say that they would like to receive mental health treatment from providers that look like them. So African American women tend to want an African American woman therapist. They tend to want an African American psychiatrist. But guess what? Only 2% of psychiatrists are African American. So imagine how difficult that is. With clinical depression, people need medication to help because the neurotransmitters in our brain can be off. Our serotonin or our dopamine levels could be running low. And while therapy and studies have proven in some studies to be just effective as medication, sometimes clinical depression is so severe that the two are actually recommended: actual therapy and medication. Those medications go in and they increase the dopamine and the serotonin levels in the brain, which helps people to improve their mood and feel better. So, guys, with that, this is our overview for our discussion on the multifaceted model of depression in African American women. I am going to begin with introducing our panel. First, we have Charcel Fordham, who I am so excited. Charcel is going to tell us all about the book that she wrote. We're going to be talking chronic health conditions. Charcel and I actually met in our church sisterhood group, and we just connected and we hit.
Really did.
We did, right, Sharcy? Going to
Yeah, from the jump.
right from the jump, Sharcy. So Sharcy is going to share her story. And then we have Asia Corbin from As I Am Women's Alliance. I'm so excited to have Asia here. Asia and I met years ago back in a mommy and me group. That's how Asia and I connected. And, Asia has this woman's group, and she has been working with her women's group, I think, for over maybe 15 years. Asia, she's going to tell us all about that. Asia is also a nurse, and she's a certified counselor. And then we have Cassandra Bolden, my fellow licensed professional counselor. Oh my God, I love it. Cassandra has her own practice in Philly. She is going to tell us all about her collective. It is amazing. So, ladies, I don't want to take up too much time talking. I want to hear your stories. I want to share. I want us all to share and get the conversation going. So, our topic: chronic health conditions, mental health, and depression in African American women. Sharcy, why don't you start with sharing your story with us?
I sure am excited to share my story. It's interesting the stats that you were reading, because my anxiety started when I was 12 years old. Yeah. I joke around a lot and tell people, like, I'm a gumaholic. I love gum. And they pick on me, but I'm like, that's kind of like, it helps kind of, control my anxiety, which is really weird. But so a little bit of my story is when I was 12. Chalice, you know me, I'm like a jokester. I like to joke around. So that's what I've always been known for in school. Yeah. So I'm sitting, I never forget this. I'm sitting in a lunchroom and I'm laughing and joking with my friends. All of a sudden, my face just starts jerking. And it's like, I don't know what it looks like, but I can hear it in my voice. So then everybody stops and look at me. They're like, they're laughing, and they're like, why are you being silly? And at that point, I'm like, I have no idea what's going on, but I'm saying this to myself. Yeah. And I just play it off, and I'm like, I don't really know what that was, but it was weird. It just happened and then, it didn't happen every day, but it would happen very often. And I thought that it was nothing big. I just didn't think to tell my parents about it. So once the jerking got a lot worse, it would not just be my face. It would be like jerking movements with my arms or my legs, or I would jerk and fall down the stairs. So that's when I was like, okay, I got to tell my parents, like, something is wrong. And so, I told my parents. My mother, being that she's a social worker, she's not good with her children being sick. She can help anybody else, but not us. So she was like, oh, your father's gonna have to take you to the doctors, because I can't handle that. Because the doctor, my primary care doctor, was like, well, we got to get her tested and make sure it's not like a brain tumor. We just don't know what's going on. So then my father started taking me to a neurologist, and they performed all different types of tests: MRIs, EEGs, sleep deprived EEGs, just to try to find out where the jerking was coming from. So after months and months of testing, at 13 years old, I was diagnosed with juvenile myoclonic epilepsy. That just kind of like rocked my world, because when I was about 7, I used to be a dancer. And one of my teachers, he passed away when I was 7. He had a seizure while he was taking a bath. Oh, no. So I can remember saying to myself, oh, I hope I never get that. So then you can imagine at 13, and it's like, I have what? And so, but then the doctor, she said to my parents and to me, she was like, yeah, everyday life is going to be very difficult for you, because the type of epilepsy that you have, stress brings on seizures. And I have grand mal seizures. So she actually told my parents that it might be best to just put me on disability, because she said life itself is very stressful. So you may have to choose what type of life you want. Do you want to be married with kids? If you do, I don't know if you'll be able to do it working or going to school. But my mother, she's kind of like that scary type of lady that I don't think so. She was like, thank you for your service, but we will find a new neurologist.
Yes.
And I remember later that night going over to my aunt's house, and my cousins were like, you need to just take her and do it. Like, get that free money. And my mother was like, no, I'm not doing that. And I remember hearing them talk, and I was like, but I'm not disabled. So I don't understand why. But the weird thing about it was when the jerking started, my learning changed instantly, overnight. I would literally sit in class, the teacher would talk, and I'm like, I have no idea what they're saying. It sounds like mumbo jumbo coming into me, and I just would look around. So I just didn't make waves. I was like, I don't know, maybe it's just me. I have to figure out like how to learn. I gotta figure things out differently.
Yeah.
And so at my cousin's house, in my aunt's house, my mother looked at me and she said, Charcel, come here. And I was like, oh God, what I do now? So
Right.
she came, she said to me, she's like, listen, that doctor is not God and neither is anyone else. You just may have to, you may have to work twice as hard to be as good. And if it takes you to working twice as hard, then you work 3 times harder to be better. She's like, but you're not disabled. So don't think you are. So I
Yeah.
was like, well, yeah, mommy, I didn't think I was. Then I, kind of told her about learning and how I'm like, I don't understand. I'm taking things in a little weird. She's like, don't worry about that. She got me with a new neurologist who was a lot like her, scary me. And like, so yeah, she was, which I needed because when I was 16, I had my very first grand mal seizure. And at that point, I was like, I don't want to drive. This is scary. Like, I never want to drive. And my mother was like, what did I tell you? We're not doing this.
Oh
And
my.
and I needed that doctor as well, because she was like, I don't care what anybody else say. You can do whatever you want. You are not disabled. So I was like, okay. But then those are the years where you're trying to figure out who you are. You're going through puberty, and that is tough in itself. But to have to deal with, having seizures or having these jerks that were embarrassing to me, and I wouldn't tell anyone. I didn't want anyone to know that I had epilepsy. So I would, I started becoming very withdrawn.
Okay.
And that's when, at a young age, I didn't realize that I was sinking into depression, because I was no longer like, oh, that jokester, because I was afraid to talk, because if I spoke, I might have a seizure or I might jerk. So I was, very quiet, very withdrawn. And like for years, I wouldn't say anything. So then in my 16, 17 years, I thought, well, maybe if I don't let me see how many days I can go without taking medication, just to be quote unquote normal. Of course, I would end up having a seizure, and then that doctor would yell at me as well as my mother, but that actually, it taught me a lot. Like I really did have to work hard, because like I said, it was instant change. Like I can just speaking now, when people talk to me, I kind of have to write things down, reprogram it in my head for me to fully understand. But at the same time, I was like, okay, no, this isn't going to keep me down. Like I'm stubborn. I'm going to work. I'm going to work.
Yeah.
So when I met my husband, he and we got married. I had my son. Yes. And I said to him, I'm going for my bachelor's degree. He was like, oh, you can do it. He's like my biggest cheerleader. So having a young son, go working full time, going to school, got my degree. Yes. I was like, nobody's going to stop me. So I said, I'm going to take it a step further. So at this time, I got a 4-year-old son, a newborn daughter, working full time, working on my master's. I was so happy when I graduated. And I was like, you know what? I can't wait to go back to that doctor that told me that I need to get, on disability. So I wrote a book because I wanted to encourage other girls and boys, but, going through that stage, to let them know, like, you're not disabled. It might be a little tough. The road might not be so easy, but you can do it. There's nothing wrong with you. And because I was told disability was my only option, I wrote a book and the title is Growing Up with a Disability, but I'm not disabled.
Yes.
And I sure enough, I wrote that book. I took it off of Amazon. I gave it to that very first doctor. I went all the way back and I was like, do you remember me? And then, so just refreshing her memory. And I gave her my book, introduced her to my family, working full time. I was like, don't ever tell a person that they can't do it, because they can. Right. It may not be easy, but we can do it.
Yes.
So,
oh my gosh, Sharcy, your story, you are such an inspiration. Do you have your book to hold up in the screen for us?
Hey.
Oh, it's okay. So where can we get your book? Tell us the name of your book.
On Amazon, and it's called Growing Up with a Disability, but I'm not disabled. And for years I did say, like, man, why am I battling? Like, why me? Why me? And then having my son, and he's such a little, and I always call him an elderly man, because he's always been like, when he was 7 years old, he's like, I want you to teach me how to balance a checkbook and cook, because I got to be a good husband and father. I was like, yes, he's 7. Like, slow down, you're mommy's baby. But then when he was 8 years old, it was 2 weeks before his 9th birthday, he started to get very, very sick. And everyone thought I was being like a helicopter mom. I'm like, no, there's something wrong with my baby. And I just kind of had to like keep fighting, because everyone thought I was just, you're just losing it. You're thinking this, you're just, I'm like, no, there's something wrong with my baby. And I told his doctor, I said, well, I'm not leaving here unless I get a script, because I know there's something wrong. So that Saturday, I took him to get his blood work, because every other test was fine, but I still noticed something was wrong. Then that Sunday, he just was not getting up. I said, I'm taking my baby to the emergency room. My husband didn't want to handle it. He was like, no. He's got the flu. He's got the flu. He runs out and tries to buy all this flu medication. I was like, it's not the flu. And working in healthcare, I saw signs of diabetes. Okay. Oh. Yes. And but the type of diabetes that he has doesn't run in my family or my husband's family. So his doctor ended up calling me as I was leaving out of my house with my daughter, and I'm carrying my son, because at this point he wasn't really waking up. And she was like, I need you to get him to the doctor right now. I think it's a lab error, but his blood sugar is like over 700. When I got him to the hospital, his blood sugar was 976. Ooh. He was diagnosed type 1 diabetic right there on the spot.
Oh my goodness.
And yes. And I was like, I knew there was something wrong. I'm like, you can't tell me, I know my baby. And, but then of course, once they diagnosed him, I was like, are you sure? And my husband is like, you've been trying to convince us. I was like, I know. And when he finally, because at that point he was in like a coma. So when he finally came to, he saw us. I was like, don't let him see us cry. Don't let him see us cry. And my husband was like, oh man, D, I really wish it was me and not you. And me joking the way I joke, I said, yeah, D, I really wish it was daddy and not you. And he started laughing. He said, guys, don't worry. God wouldn't give it to me if he didn't think I was strong enough to handle it. And it was him that, but then of course, he battled his depression, going through having to, check his blood sugar. He didn't like giving himself insulin in front of his friends, so he like fought me tooth and nail, like, mommy, I want an insulin pump. This way I could feel some type of normalcy. Oh. And I was like, okay, if that's what you want, that's fine, And now he's 18, he's in college, he's working, he's doing his thing. And then he actually texted me last week and he's like, I have a doctor's appointment at CHOP because we're transitioning him into adult care. And he was like, you want me to go? He's like, no, I don't need you to go. And I texted him, like, you don't need me. So he called me. He's like, are you crying? I was like, no. He's like, mommy, you told me all the time about your life, your struggle, with epilepsy. This is my battle. Let me do it. Let me make you proud of me, like grandma is proud of you. So, I was like, okay, you know what? Now I feel like I had to go through what I had to go through, to be that strong figure, especially for my baby.
Yeah. Oh my God. I love that. Sharcelle and Asia can identify with you, because we got a nurse here. Asia.
Oh, yeah.
I don't know if you wanted to chime in, or Cassandra, if you wanted to.
Yes, yes. Well, he had juvenile diabetes, which
Hmm.
children do receive. And it's funny that it doesn't run in the family, because usually that's when it attacks with juvenile diabetes. If in
Yeah.
fact, for most cases, if it runs in the immediate family. So
Yeah.
that's really interesting. But God be the glory. God be the glory.
Yes.
And
He's like
so,
my little strength,
oh my
whenever
God.
I feel like I can't go through, because Chalice knows that recently I was diagnosed with trigeminal neuralgia. So
Oh,
it's like my pain is like every day, all day. Even
wow.
like getting on, I was like, oh my goodness, how am I going to get through this?
Mm,
And I was like, no, I need to be here because, and then of course, trigeminal neuralgia is that fifth cranial nerve, right there in your face. So there are times where it sets off my seizures.
my God.
So it's like I'm battling that, but it's like I gotta push through. I gotta
Wow.
push through. Yeah, there are. It's been some very, very tough days. I think one day I was just like, I was in so much pain because it's just nonstop pain. I've had so many different epidural injections and just I refuse to get the surgery because it'll leave this side of my face numb for the rest of my life.
Yes.
So I'm like, no,
Yes.
I don't want to do that. So I was
Mm,
just I'll never forget. I was just like on the floor in my room in like fetal position. I was in so much pain. And my
mm.
daughter came in, and when she came in, I was trying to like wipe the tears and I was like, hey baby. And she was like, are you okay? And I said, yeah. She was like, mommy, let's pray because I need you. I need you. I don't want nothing to happen to you. And I was like, I'm okay. So I let her pray over me because she wanted to. And I'm like, okay,
Amen.
I gotta figure out a way to get through this, to deal with this. And I started working out, which kind of helps loosens a lot of like the pressure, but and it's brought the pain down somewhat. But because of the constant pain and pressure, it's been since 2020. It
Wow.
kind of constant pain, it just detached my retina. So
My
there,
God.
and I had August 1st I had eye surgery, and they sewed a scleral buckle on my
Oh,
eye, and they said, we'll see in a year. It's gonna take some time to see if it'll heal, to see if I get like my vision back
yeah.
in my eye. But I'm like, no, it's gonna come back. They're like, well, we'll see. I said,
Wow.
no, it's gonna come back.
Yes,
Yeah,
yes. Glory to God.
yeah.
Well, this is an amazing panel because we have an herbalist,
I know.
on
That's
the
why when she
panel
said, I was like,
tonight. Correct. And I was going to direct you to
wait a
her
minute.
because, the mind, body, and soul and the healing and the natural
Mhm.
remedies, again, I'm a nurse by trade, but like, I don't believe in, if so much modern medicine that we can take, but I think herbs and yoga
Herbs.
and things like that to cure. It's from the inside first. So,
Yes.
with taking those type of remedies, it heals the other ailments that come along or try to come through your body, but
Yes.
naturally, because when you heal
Yes.
yourself naturally, no medicine can beat that,
And that's the thing.
so
I refuse to take any type of I started doing acupuncture. Um, and
yes,
that's what's been helping me. Acupuncture, and
absolutely,
I've been doing a lot of yoga and just,
absolutely,
exercise because the medication that they were giving me, I was like, it's bringing on this weight. I said, but it's not taking any pain. I'm like, I don't want any more medication. I'm like,
right.
no. But they just was like, well, I don't really know what else to do for you.
Hmm.
So I said, well, that's okay. I know what to do.
Hey, that's right.
How about Cassandra? Cassandra, did you want to share something?
Yes, yes. You've
Mhm.
said so many. I'm just kind of unpacking everything that you shared, and I'm thinking about like what we were talking about in the onset of discussion, the intersection, in terms of like all the things that you mentioned, right? And then the gender bias and the racism that's permeated in the medical system,
Yes.
and how you have to kind of constantly advocate for yourself because if you don't, you will get steamrolled,
Yes,
Yeah.
and being able to take the initiative in terms of guiding your care, in terms of identifying what works for you, what works for your body is so imperative in terms of your healing and
Yes.
not just your physical healing, but your mental and your emotional healing as well. and being able to take back and you know, I understand it from so many different vantage points as you were sharing. I'm like, wow, you know, kind of being so young and as you're developing body autonomy and, you know, having that agency over your body, and then something is happening in your body that you can't control, that's disrupting that process.
Yeah.
And so learning how to trust your body, learning how to trust yourself in your body, right? Like all those things happening simultaneously as the, you know, like you said, like that kind of synergy of the anxiety and what's happening in your body kind of strengthening the other and worsening the other. So it was just that you just shared so much. And then I think on the spiritual, you know, side, what you shared in terms of having this experience and identifying the gifts of your suffering, right? Because the gifts of your suffering was that you had to experience this suffering at such an early age.
Yeah.
And with that, you were able to not only write a book that is going to help, I'm sure, many other boys and girls that had that experience. But in addition to that, you're able to have a level of empathy, compassion, awareness, patience that, you know, you wouldn't have had you not gone through that
Exactly.
experience to be able to offer to your son. So
Yeah.
you just said so much, and I'm just sitting here kind of just unpacking it all, but also so inspired by you and
Thank
your strength,
you.
your courage, your bravery, and also your vulnerability, which is a superpower. And most people don't think of it as a superpower, but
Yes,
it
it
is a
is.
superpower. So thank you for that.
Oh, thank you so much. I
Yeah.
love everything that you guys say. Thank you. That's so encouraging.
Thank you for sharing.
Oh my God. Thank you.
Always.
I love you, ladies. I knew this panel was going to be awesome. Thank you, Sharcy, so much for sharing your story. I second everything that Cassandra and Asia said. And so now we are going to move on to Asia Corbin of As I Am Woman's Alliance.
Yeah.
Asia, share with us.
Yes. So I wear my shirt proudly today. As I am Women's Alliance. Yay. I have been, thank y'all. I have been doing this for over 15 years, actually, with helping women and youth and young women find themselves, find their purpose, find their superpower. Because all of us have one. All of us have one. And, you know, I always say that, you know, women, unfortunately, some of us are so busy looking at others' superpowers, you know, on IG and Facebook and all these other things, you know, instead of using what you have, you know, instead of getting into your own superpower. Like you're busy spending gas on this other queen when your tank is ready to go. Your tank is full and ready to go, and you over here in somebody else's yard. Like, you know, stay in your lane, focus on you,
Yeah.
know that you are worthy, know that you are needed, know that we need you, I need you, you know. And that's my message to every youth, every child, every female, every queen that comes through my door. And it came from my own experience of not being told that I had a superpower, not being told that I was great and I was wanted and I was needed for this world, you know? And so I turned my story of so much negativeness in my home, unfortunately, growing up with my mother. I grew up in a two-parent household. I had my father as well, but he was a type of man, very passive aggressive and very. My mother just belittled him every chance she could get, every chance she could get, and so. She really set the tone, unfortunately, in a negative light for my sister and I of how to treat a man. That's a whole nother aspect. That's a whole another aspect because who dare to tell their mother that they're wrong for the way they're rearing their child? I mean, that is just in my day. I'll let it be known. I'll be 50 in June. Thank you. Yeah. But in my day, you better not
Right.
ever speak any ill will to a parent, whether they were wrong or right. That is not your place. You have no right. You do what you are told, and that is it.
Yeah.
So, so if growing up in that type of environment, I had no voice. I had to only see the wrong things that were being done in my own household. And unfortunately, my husband of almost 20 years
What?
had
Go ahead, 20 years?
almost 20 years. Yep, it'll be 19 this July. And the ups and downs and the roads were very tough because I didn't know anything but what I was taught. So I started doing the belittling and the tearing down and not building up and all of these things. And so it made it rough for the marriage, until I started to turn around and look at myself, and unfortunately, my sister at the time was following my mother's lead as well. So, there was no encouragement there. I didn't have anyone to turn to say, hey, did you notice that you're treating, that you're, excuse me, talking down to your husband or talking down to people, and she wasn't ready to face that at the time, but I knew that I needed to do different. And I knew that in order for God to start healing me, I had to be honest and be open and be ready for God's healing. And then that's when I started realizing and that my mother and being told actually to my face that my mother didn't want me, and I was the devil. I mean, all kinds of things. I'm her young child, and just real abuse, just abuse. And and there was no rhyme or reason for that, and I couldn't understand why. The more I did for her, the more she hated me. And unfortunately, this is many women's stories. This is a lot of women's story, and nobody wants to talk about this. Nobody wants to ever ever face or be confronted with saying that the one that birthed me was not there. And so it's very difficult. But so I said, well, God, how do you help me? I need help, and I am as I am. I remember stating it just like that, having a talk with God. And then I said, that's the name of the group, as I am, because I was currently walking in my mess, in my stuff that was trying to kill me. I mean, the weight that was on my chest of depression and loneliness and not being wanted. I mean, it was very, very heavy, and it was the avenue to destruction. And if it wasn't for the grace of God to walk with me this entire time, I wouldn't be here to tell this story. I wouldn't have been able to help over 250 plus women.
Yes.
And 1,000 women online. And the devil is busy because the devil tried to knock down my Facebook group about a year ago, and I restarted it up. I said, devil, you're a liar. Right when we were getting into the nitty gritty of issues and depression and people saying, Asia, if it wasn't for your group, I wouldn't be here today, and so God was working, and of course the enemy is upset, so I have to shut it down. I have to not allow this to prosper. So so I had to restart the group again, and God is so able, because now I'm getting to where I was and surpassing my numbers. And and it's all about healing. It's all about taking off this mask, and motherless mothers is one area that we talk about. I talk about everything, there is because, as I am, it's just how God accepts all of us. And so why would I not accept you as you are? You
Right.
know, so that you can get healed as well. I feel like in the corporate world, especially, there's so many women that sit at the top of the table, at the head of the table, and they are just so broken. They are so broken and so bitter. And I have met some of these women, you know, and you would be shocked at the companies that they work for, and even within their own companies, you know, how the mask that they put on and the face, and they are just so miserable inside and so broken and so beat up and not having a voice, not having an outlet. And you know, I said, God, you know, like this, like the Bible says, if I could touch one, if I could help one woman, you know, in this fight to healing and to be whole and to not feel broken and to be feel wanted, I have done my job. I
Yes.
have done my job. I have done my job. So it's my calling, it's my gift. It comes naturally to me. It is what I am and what I do. And you know, and I'm telling you, the Lord has already told me I will not be in the OR working in that area anymore. I will be working in as I am, bringing more of the patients from the hospital directly to my group for healing, because you know, it's so needed. It's so needed. And people don't understand how much a hug can help, how
Yeah.
much just a hug, just somebody saying that it's going to be okay. I do that every day on my job, and you don't know what that does for my patients. And so they leave me, and sometimes they leave to go back to a homeless shelter, or they leave to do that. Sometimes their peace is being in the hospital, because they get food, they get clothing, they get a warm bed. You
Yeah.
know, some people fake injuries so that they can have somewhere to lay their head because they don't have it. So as I am is so broad, you know, because we help the homeless, we help people that just need to heal, we help the people that are having manic attacks, psychotic episodes. You know, these are the people that unfortunately a lot of folks do not want to be bothered with. They
Yeah.
don't want to be bothered with. They don't want to be bothered with the drug addict. They don't want to be bothered with the stripper. They don't want to be bothered with the woman or young girl that just came out of prison, you know, because she had a hard life or she had to do what she had to do. Nobody wants to be bothered with them. They call, you know what they call that? They call it waste. They call it waste. They call those people waste. Oh, oh, as I am deals with the waste. I've actually heard some people say that to me.
Oh my
How
goodness.
can you work with people that are just waste? That's a waste of time. That's a waste of money, a waste of energy, you know? And, but God said,
Yeah.
but God said, right, that this is my calling. This is what I do. My husband has another nonprofit called Huruma, where he works with the youth and he works with adults as well, with men and youth coming out of prison. And he has a program called Books Up, Guns Down, because there's so many boys, young men, unfortunately, that are picking up these guns. I mean, you see the violence that's going on, and it's not just in Philadelphia, it's in all of these cities, unfortunately, right now. It is in a lot of cities, and it's not just the guys, it's the girls too. It's the girls that want to be the ride or dies, and I can, you know, I can hold him down and all this stuff and take on his whole case. And then they end up going to prison. Some kill themselves because they didn't have any guidance, you know, to know not to get with a guy that's in that type of environment, you know. So it's just, it is not enough people out here to help in this area, you know, in this area of helping these young girls and men turn into and turn into kings and queens.
Yeah.
It's not enough programs out here. I mean, we're a small company and we're growing, but I mean, we need so much help out here. And I hope that some women, I'm sorry, are on the line with their youth, because this age between 13 and 18 is when you see the gravity of it. It starts younger. Statistics say that through the age of 11, actually 11 to 18, unfortunately, especially in African American homes, is where you see the crime and the killing of the people that they just want to rob, or even in their own homes, killing their parents, killing their sisters, stealing from them and stealing drugs and just doing whatever it is that the devil tells them to do. So
Asia, and to add to what you're saying, the suicide rates have skyrocketed among 15 to 24-year-olds.
Yes, they have. Yes, they have. I just went to a funeral 3 months ago that a young girl, she was only 18. She was on her way to college. She was doing hair, and she killed herself. She killed herself. The peer pressure, people, saying, "Oh, well, you're doing too much." That's the new word out here. You're doing too much. But what do you mean she's doing too much? Because she's not in the streets and she wants better for herself. It's so much jealousy among these young children out here, and even adults, unfortunately, even from one queen to another. Like, we just can't congratulate each other and help each other and network with each other, just like how we're doing. Like I asked Cassandra, what can I want to bring the women to you. I mean, that's what it's room for everyone to eat. And I'm not understanding where the disconnect is. I'm just not understanding. And the jealousy and the hatred and the not, not wanting the next sister to put her crown on. We are here to assist each other and shift the crown to make sure the crown sits up in the middle of the head. That's what we are here to do, from one queen to another. Anything other than that is not of God. It's not.
Asia. And let me tell you, Asia, when you talked about what you're talking about now, and when you talked about motherless mothers and how you were treated by your mother, as therapists, we're trained to use family genograms for family therapy. And I know, Cassandra, you're familiar with this. And when we look at family genogram, we take a look back at 3 generations. So one generation, your parents, and then their parents. And when you talk about these things and we bring the spiritual aspect in it, there are some spirits that rest on certain families. So say, for instance, you brought up jealousy. If a spirit of jealousy rests on a family, right? And let's not even bring the discussion. We're going to bring the discussion of epigenetics into this conversation, because with epigenetics, trauma is transformed, or it shows up in our DNA. It doesn't change our actual DNA, but it's observed in our DNA. So if the grandmother struggled with a spirit of jealousy, for instance, and she made her children jealous of each other, and everybody was
there you go.
Now you have the next generation, her daughter. Now her daughter's struggling with the spirit of jealousy. Got her in competition because she learned that from her mother. Then the child that this mother had, and you could see in her children a spirit of jealousy, and this one competing against this one. But through epigenetics, that stuff is also passed down through our genes.
Yes, it is.
Can you imagine that? I read a study of a family who was struggling with domestic violence. The grandmother, her daughter, and then her grandchild, they all were in domestic violence marriages. And through this research, the researchers tracked it through epigenetics. From a spiritual standpoint, we call that generational curses.
Yes.
Many of us, like you, Asia, like me, like Charcel, like Cassandra, God will call you to be the generational curse breaker. So what's happening
Here, that's right.
generations before, the buck
Yeah.
stops here, enemy, because it's not going to continue. And I'm not going to pass that on to my children. I'm not going to create competition between my children and try to make my children jealous of this. You know what I mean? And it's really a shame how it passes down through the generations, Asia, but you are so on point, and I understand too what you're talking about, Asia, with working with the different populations. Like I started off as a social worker. I started off as a residential counselor in boys' homes. I worked in a crisis center, in a hospital alongside of a nurse. You're right. People that didn't have food to drink, just having somewhere warm to sleep, and a hospital food for the homeless, working with the homeless, working with severe, persistent, mentally ill, people, volunteering at a domestic violence shelter, working all of these populations over the years. So I really commend you, Asia, on the awesome work that you and your husband are doing. Please invite your husband and his group to my inaugural Movember Men's Forum. It's a boys to men. You can have your husband along with your son on there. It's going to be all about boys to men health. We're going to be on mental health, physical health, and spiritual health.
Wonderful. Absolutely, I will.
So
Absolutely.
Let's hear from Cassandra Bolden. Cassandra, I know we done said a whole lot, Cassandra. The floor is yours.
No, I mean, I just want to circle back to what Asia was sharing. First, I want to say thank you for having the courage, to be able to do the work that you're doing, because you're not just doing the work on yourself, you're doing the work on the generations before you and the generations after you. And I think the interesting thing about what you shared and kind of, I think where the conversation was going was that sometimes we just think about the micro, we think about what's happening right now, but we don't think about the macro or the generational or the historical context, right? When you think about racism and you think about the impact of racism, and like you think about mothers and grandmothers and great grandmothers and the stoicism, right? Like it seems like they don't care. It seems like they're so hard, but it's like understanding where that comes from, that they had to be to survive the things they had to survive. They had to be hard. They had to be stoic, and loving your child and having this emotional connection and bond with your child was something that could get your child sold and you sold. So there was always this fundamental underpinning of a disconnect, because I'm fearful that if I show too much love and attention for this child or my partner or my husband, they might be sold away. So it's just thinking about too, like historical context, where a lot of the behaviors come from. And we could have a whole discussion about that in and of itself. But when I was listening to you, I was listening to that and I'm like, wow, I wonder what her mother's story was and her mother's story was, right? And why they behave the way they do. And like you said, like kind of just recreating what you saw, because that was normal, right? Until you learned that there's a different way, until you were exposed to more and there was an intervention and you learn like, oh, there's a different way. And what was so powerful about your story and what you're doing with other women is that you're going back to the narrative, right? Because there was a narrative about Asia, right? Because you learned that from your mom and how your mom treated you and the things that she said to you. So you told yourself some negative things about you, right? Because you just continued what she said in your own voice. And then the work that you had to do was to change that narrative. And the beautiful thing is that you're carrying it forward and you're like, okay, now I'm going to teach other women how to change that narrative, and then other men and other people in general. So the work that you're doing is powerful, powerful work. And
it really is.
Before I started my little spiel, I just had to say that because I'm sitting and I'm listening and I'm like, wow, like that's powerful, because there's so many of us that have been wounded in that way, and we just carry it forward and just recreate it and not understand what we're doing. So it's so powerful that you understand and you had the courage again to be able to face it and then change it. So kudos to you, Asia. Absolutely. So I guess when I was thinking about the question, and thank you so much for creating this forum, for having this dialogue, because I think it's so important. And it's such an expansive dialogue. Like when we talk about Black women or African American women, breast cancer, depression, we're talking about the whole family system. We're talking about the whole community, right? We're talking about all of that, because when we experience it as the caretakers of our children, as the matriarchs of our family, most times we're also the families being impacted, and the families impacted, the communities impacted. So we're talking about this larger picture. And so when I think about the work that I do, I guess I'll start from 2020 and then work my way forward. So you know what was happening in 2020. So um clinicians like myself, African American clinicians, we were inundated with not only clients but also DEI work. So we were swamped. And the thing about it that made this experience so unique was that we were having a shared experience with our clients. And so because we were having this shared experience of collective grief and collective trauma, I was burnt out. And so were my colleagues, the people that I was supervising, like other practitioners and healers. We were burnt out because we were experiencing our own direct trauma from what we were experiencing, but then the vicarious trauma from our clients and our family members who were having their own. So it was just like, it was a lot. And for my own mental and emotional well-being, I incorporated practices that I had incorporated before, but more so during that time. Like you mentioned earlier, yoga, meditation. I was using sound therapy, using nature as a form of healing. So I was getting out every day, taking walks in nature, and being able to utilize nature as a remedy, because I was really destabilized. And so I would get in the dirt, put my feet in the dirt, put my hands in the dirt sometimes, and just ground myself and get centered so that I could get stabilized, because I was very dysregulated because there was so much happening during that time. And there was a recognition amongst myself and my colleagues. I said, we don't feel safe anywhere. Like you can't feel safe outside. You can't feel safe in the grocery store. Like there was so many different things happening in your home. Right. So it's like, where are we safe? And so you know how we do, all of us talked about it, right? From our suffering were the gifts, right? Then it's like, okay, I got to create something, And so I was in and this is not a coincidence. And I understand that there is so much guidance and direction if we just pay attention. And I was going to this wooded area every day. And there was one particular time where they had a detour. So I had to walk a different way. And I walked into Rittenhouse Town. And so Rittenhouse Town is a town inside of this park. It's a historic town. And I saw this huge, beautiful house. And it was all the backdrop was the woods, and it was just gorgeous. And I said to myself in my mind, I'm like, wow, this would be such a beautiful space to create what I want to create. And literally, I turn around, there's a community board. It says, wouldn't you like to lease space here? Wouldn't you like to work here? And I said out loud, I said yes out loud. And I called the number. And, by the next day I was there seeing the space, etc. And I said, I'm going to create the space, right? The space that I desire to experience, but also a space for other healers to be healed. Because our healing work is so vital. And much of the time we ignore our healing work, and especially as African American women, we're taught to do that. We're taught that we're secondary, and that everyone else, or even like somewhere else down the line, that everyone else comes first. And so this was a space, it was a declaration for myself to say, no, I have to be full in order for me to give. I have to pour from my overflow, because I'm on E. And I'm like, if I'm on E, what is the quality of what I'm giving? Even though I might still be able to give, what's the quality of what I'm giving to my clients, to my family, to my friends, and most importantly, to myself? And so, creating this space was so important. So I put all the things in the space that I knew worked for me, that were helpful to me, that were part of the things that I referred my clients to. And just to backtrack, I've been in private practice since 2012. And I've been, I'm a certified trauma specialist, PhD candidate in international trauma psychology, EMDR, hypnotherapy, all the things. And so fast forward, I worked in a lot of different agencies, saw a lot of systemic racism and how it permeates all these systems
Yeah.
and reduces our effectiveness and the frustration that you feel and the fatigue that you feel. And so I got to a point in 2012 where I'm like, you know what, I'm done. I'm going to find my number that I need to make in order to be fully freestanding. And I
Yeah.
made that number, and then
Yes.
I disconnected myself from anything and anyone that was not in alignment with what it was that I was trying to create.
Yes, ma'am.
And so,
Yes.
listen,
All
and
right.
that was like fast forward. So I was in private practice and I had these spaces, but I never had everything in one space. So
Right.
being able to provide the therapy and have yoga, meditation, acupuncture, sound therapy, an esthetician. We have reflexology, we have functional medicine doctors, naturopathic doctors. So underneath the collective, I structured the collective like a collectivist societal structure where we come from, right? Because we come from, as African people, we come from a collectivist societal structure. So the one depends on the many and the many on the one, right? So all these individuals come together and support one another. So I allowed for all of the businesses that come, they're not working for me. They're working under the umbrella and still maintaining their autonomy as autonomous businesses underneath it. So we just work together collectively. So it's
And
just really interesting. Yeah. And it works.
Awesome.
It works.
I
And
love
so the focus is on, you know, each of the clinicians that work there. Like for me, when's the last time I saw my therapist? When's the last time I got a massage? And for each of them, we check in like, okay, massage therapist, when was the last time you had a massage? Okay, esthetician, when was the last time you had a facial? So we check in with each other, and that's community care. We talk a lot about self-care,
yeah.
but this is all about community care.
Yes, I need
So
that.
that was a big part of
Oh,
this journey. Yeah.
Wow. We are all
Sandra.
wow.
Wow, that's awesome. I'm like, I want to come by.
I know.
yeah, I know. I was
206 Lincoln Drive.
Okay. I'm like, I'm looking at both of you. I'm like, I want to check out as I am and bring my daughter. I'm gonna have to come by. I'm like,
yeah,
Road
yeah,
Maybe we could all meet at the Lotus, the Black Lotus Holistic Health Collective.
yes, what's the address again?
206 Lincoln Drive, and it's in
Oh,
Philadelphia, PA.
yes.
19144.
Yep. Because I'm a Chestnut Hill girl, so I know
Oh yeah.
exactly
So
talking
you're
about.
right there. Yeah.
Yeah.
We're gonna
Yeah.
have to take a road trip on over to the Black Lotus, Cassandra.
Yes. I'm looking
Yeah.
forward to it.
Absolutely
definitely.
have to network. I'm sorry. I'm Chalice. I'm taking over. I'm sorry.
No, it's okay because listen, that's exactly why I put the panel together. And this was not a coincidence. God knew what he was doing when the three of us, well, the
Yes.
four of us would all get on a panel together. So no, that's what I want. I bring people together. I want people to network. And we're all, like you said, Asia, we're all about celebrating each other and being able to say, girl, you go ahead. You did that.
But
Yeah.
that's how we get our win, by celebrating.
Exactly.
And
What
that's
I love about all of us is the inner dialogue with ourselves. We don't get so down to the point where we keep ourselves down. We build ourselves up, you know? And sometimes that's hard when the world is constantly telling you, you can't do this, you can't do that. But we don't allow that to get into that inner dialogue. We're like, no, I can do this.
Yes.
yeah. Well,
Inspire others.
Yes.
And we inspire others. So we take our pain and we have turned it into purpose, really impact and affect others. And it's just such a blessing, you know? So I could each and every one of us.
Yeah. And I tell my women and in my household that can't is a curse word here. We don't use that curse word. If you say can't, you're gonna be in trouble because you have curse at home, and we don't do that. So there is no can. I don't even know what that means, what that looks like. Like, what are you talking about? You know, it's I will and I have.
Yes,
I love it.
That's it. You know, so
as I am.
As I
am. So does anybody have any questions or anybody want to share anything or any, final comments or anything for any of the panelists? And even for, the people that are on the panel, you guys have any final questions or comments? I mean, this conversation was awesome.
Yes, yes.
When is
Well,
the Black Lotus?
huh?
When is the Black Lotus?
You said where?
When?
Oh,
When?
the Black Lotus Collective is it's an actual building in Pennsylvania that she was telling
Okay.
us about.
206 Lincoln Drive, right?
Yes.
Okay.
Yeah, 206 Lincoln Drive. So we have resources and services, but we'll exchange information because I'll make sure that we're connected.
Oh yeah.
206 Lincoln Drive, and we have
We're all
Yeah.
on email, so everybody's on that group email chain.
Yep, we sure are.
We can also coordinate our road trip to the Black
Yes.
through our,
Yeah.
our group email ladies.
I think we need to do that this Saturday coming.
Oh,
Yeah.
look at Asia, we all got to look at our schedules, girls.
Right. She like tonight.
Pull some stuff aside. So
Yes. Well, listen, ladies, I thank all of you phenomenal women for joining my Talk the Wellness Tea with Dr. Chalice panel tonight. Sharcelle has her book on Amazon. Sharcelle, remind us again, what's the title?
Called Growing Up with a Disability, but I'm Not Disabled.
Love it.
amen.
Asia has her As I Am Women's Alliance group. And Asia, can people join? How can people join? Can they join via your Facebook group?
Yes, they can join via Facebook. It's As I Am Women's Alliance. It's a cover. You'll see it. It's a woman with a mask on. And behind the mask is tears. That's our page. That's our monologue there. So please join. We welcome to have you. As I say, every time someone joins, I don't say welcome to As I Am. I say welcome to the love.
Yes.
I love it.
And Cassandra, would you like to share your information one more time?
So we're the Black Lotus Holistic Health Collective, and on Instagram we're blacklotus.hhc, and on that page you'll be able to find our link tree, which will tell you about all the events, and you can actually follow us on the Instagram page, but also on the link tree. It'll also take you to our Eventbrite page, so you'll see weekly what events we have going on, and then you can follow all of those and you'll be able to get updates.
Beautiful.
And listen, guys, I'm Dr. Chalice Rhodes. You guys can find me on Instagram, LinkedIn, Facebook under Dr. Chalice Rhodes. Please download my app, Dr. Chalice Teach. I'm a breast cancer survivor. I also taught in higher education for 12 years. So I created my very first course in my own app. It's called Thrive Breast Cancer Survivorship. So go on ahead on over. And I'm currently working on a course called How to Break Free from Emotionally Abusive Relationships.
Wow.
So go on and download that app, ladies, because the course is coming. Ladies and gentlemen, also, please, November 13th from 7 to 8:30, we are having our inaugural Movember Forum for Boys to Men Health. We're talking mental, physical, and spiritual health. Please invite your husbands, any men that you know, and their sons or their nephews or their godsons or their cousins, whoever, because we are going to have a great discussion. I thank you all for volunteering your time tonight and for sharing your stories. Thank you, ladies.
Thank you so much for having me.
Have a great night.
Let's connect. Bye.
Yes,
Let's
definitely.
connect. All right, good night.
Good night.